There are a lot of habits or behaviors in men that can affect their sperm production and cause infertility. These factors, you can easily prevent them, or sometimes you can avoid exposure to certain things that can affect your sperm production and cause infertility. There's been increasing incidence of infertility among couples. About 15% of couples suffer from infertility, and 30% of those couples suffering from infertility have their problems stemming from the man, meaning that a third of the times it's the man having problems. Therefore, it's very important to focus on male fertility issues as well. For a man to have optimal chance of fertility, he should have three parameters satisfied. One is the sperm count should be at least 20 million sperms per male. The second parameter is that 60% of the sperm should have normal appearance. A normal sperm has one head and one tail, and not two tails, not two heads. The third parameter is that 60% of the sperm should have normal movement, meaning they should swim normally, not dance around. So if those parameters are met, then there's high chance that the man can achieve fertility. Sperms are produced in the testes, which are egg-like structures, two of them located in the scrotum, which hangs just down under. The reason why it hangs freely is because it gives them the optimal temperature for sperm production, as the temperatures in our body is a little higher compared to the temperature required for sperm production. Now, what are the things that men do, or what are the factors that can affect sperm production in a man? Number one is drug use. Drugs like steroids, anabolic steroids, are used by bodybuilders, but these steroids can affect sperm production by reducing the testis size and then also reducing sperm production and may cause infertility. Other drugs like cocaine and marijuana can affect sperm quality and sperm count and therefore resulting to infertility. Number two is alcohol use. Excessive alcohol use can reduce testosterone hormone in the blood. Testosterone is one of the hormones required in sperm production, and therefore reducing its concentration means that the sperm production is also affected, and therefore the person can suffer from infertility. Number three is tobacco smoking, which can also reduce sperm count and cause infertility. Number four is tight pants, men who wear tight pants, men who use laptops on their laps, so men who use saunas and hot tubs. These behaviors can increase the local temperature around the testes and can cause infertility, and therefore avoid such scenarios that can cause overheating of your testes. Number five is excessive emotional stress or depression. So men who suffer from excessive emotional stress and depression can also suffer from infertility. Therefore, it's very important to try and avoid situations that can lead you to that, or try manage stress effectively, like trying to talk to somebody you can trust. Try to focus on things that you can manage, and also try relaxation techniques like yoga and meditation, or you can talk to a psychologist or a doctor to assist you. Number six is weight gain. Obesity can directly affect sperm production and cause infertility in men, or it can influence the hormones that are involved in sperm production and may cause infertility. Number seven is environmental exposure to chemicals such as benzene, paints, pesticides, herbicides, or heavy metals like lead. This can also affect sperm production and may cause infertility. Other occupations like long-distance truck drivers and men who work in steel industries can also affect their sperm production, and therefore if you work in steel industry, make sure you have good protection and also take regular breaks. If you drive trucks for long distance, make sure you take regular breaks to give your testes room to breathe. Number eight is STDs. So sexual transmitted infections like HIV, chlamydia, and gonorrhea can cause inflammation of the testes and the tubes surrounding it, which can cause scarring and therefore affect sperm production or sperm flow, resulting into infertility. Number nine is trauma. So men are usually careless and they don't protect their testes, so people can kick around the testes or anything can happen sitting on it. This can cause trauma and inflammation, which again causes scarring and can cause infertility. Number 10 is about diet. There are some men who are gluten sensitive or they have celiac disease. So gluten-rich foods are barley, rye, oats, and wheat. And you can find them in foods like cereals, beer, wheat products like bread, and so on. So if you're one of these men who have this condition, it's better to eat gluten-free diet, because consuming gluten-rich diets can worsen your celiac disease, which in turn affect your sperm production and may cause infertility. Number 11 is undescended testes. Usually when a child is developing in the womb, the testes start developing in the tummy. But by the time of birth, the child has their testes descended into the scrotum. If a baby's testes is not descended in the scrotum at birth, it's very important that you inform the doctors. Usually doctors, we examine the child at birth and we recognize this, but if the doctors miss, the parents should be able to identify and take the child back to the hospital so that they can be monitored, and if it doesn't descend, it can be operated, because if the testes remain in the tummy, then it can cause infertility later in life. And these testes that remain in the abdomen also have higher risk of developing cancers. There are also other medical conditions like diabetes, sickle cell disease, another disease of the blood called the thalassemia, and also spinal cord injuries, varicocele, which are swelling around the testes. All these can cause infertility. So when you have this condition, it's better to see your doctor and try to manage it effectively. There are also medications that can affect fertility. One of those is blood pressure medication. So if you have high blood pressure and you're being treated by the doctor, it's important that you discuss with the doctor which medication can be best for you. If you find this video useful, please share with your friends and subscribe to my YouTube channel. Thank you very much. This is Dr. Ice.